Joining me at this point is Tossas Milligan. Hello, Kathy. How are you?
Thanks for having me. Good, thank you.
Kathy is a PhD student in the School of Public Health, and she's one of the students that are working on behalf of the Urban Health Program in this project with the American Cancer Society. Thank you for being here. Kathy, tell us a little bit about the project from your perspective. What kinds of things have you been working on, and what sort of things interest you most about the project?
Well, for me, this is a really powerful project because it sort of ties in together everything that I personally have learned through my education at the School of Public Health. The students that are part of the project, the three of us primarily are part of the School of Public Health. And I feel that this project represents sort of everything that we learned. It's sort of where the rubber meets the road, as you mentioned earlier, where we have an opportunity to meet real patients and actually, allow them to participate in the programs that we create, and in that way serves as advocates for them and teach them how to advocate for themselves.
Mm-hmm. Yeah, I understand. I know, in fact, that there's two of your classmates that are working with you. Are they doing the same kinds of activities, or are they doing something different?
Yes, they are. Yeah, the three of us are engaged in educating the patient about the program, about the resources that are available through the program and through the American Cancer Society, and guide them through the process from teaching them what are the types of tests that are available, like Adrian mentioned, all the way through to scheduling an appointment and following through with them to make sure that they complete their appointment and that we get the results back. So sort of completing the loop. The wonderful thing about it is that I feel that it sort of completes, the partnership completes some gaps that exist. For example, in Stroger, we are able to provide a screening mammogram and a screening colonoscopy for a patient that normally might not be able to get one. And I think that that's wonderful.
Mm-hmm. I'd like to remind our viewers that you're watching the UIC Urban Health Hotline, and you're on the air. If you have any questions, feel free to call. I understand we have a caller. Caller?
Yes?
Yes, you have a question?
Yes, I wanted to know how is this project helping her with her studies?
Very good question. In fact, that was one that I had as well.
Yeah. Well, sure. To me, again, as a graduate student, we study these concepts in the classroom. We talk about how to create programs that, advocate for people in the field. And to be able to participate in this program sort of from the ground up, from creating the materials to, going to the Stroger Hospital and getting the patient, et cetera, it's been extremely helpful around, again, putting in practice what it really takes to develop a program and implement it, right, and collect data and ultimately help people. What are truly the barriers for people? I think one of the things that the American Cancer Society does best is the fact that they are able to provide resources for people, to complete their appointments. So do they need childcare? Do they need transportation? And so those are some of the things that I feel that you talk a lot about in the classroom, around, well, people lack access to these services, but perhaps it's not the fact that the service is not there, but there are other things around the person getting to that service that are also, barriers. And I think that, organizations like the American Cancer Society has resources available and they can provide these to the patients.
Mm-hmm. I think that answered your question, caller. Thank you for calling in. Kathy, what kinds of things that you are working on now that you think are really particularly beneficial to people in the community? Do you find that there's one thing or another that is more helpful
Within this program?
Yes. Mm-hmm.
So, for this particular program, again, the fact that we are sort of teaching the patient that normally would not get a screening mammogram or colonoscopy is particularly powerful. I am big, again, on the issue of advocacy and the fact that we are telling people this service is available to you. It might not be available through this, venue, but it is available through this venue. And, like Adrian said, get the service, complete the test, and then tell the people in your community. I think, again, that bringing that resource and information to their community and having other people, come in and get tested is powerful, particularly for us as people of color, given that these issues are, impact our community at disproportionate amounts when compared to whites.
Mm-hmm. Viewers, I want to remind you once again that you're watching the UIC Urban Health Hotline. Feel free to call in. You could reach us at the number listed at the bottom of the screen, area code 312-738-1060. Joining me this afternoon There's Mrs. Adrian White, who is Vice President for Health Care Initiatives and Advocacy for the Illinois Division of American Cancer Society, and Kathy Tollus, who is a PhD student in the School of Public Health here at the University of Illinois at Chicago. Kathy, tell us, we have a number of viewers that have children or people that are interested as career changers even in the health professions. What would you advise them in relative to if they were interested in pursuing a degree in public health? What kinds of things would you encourage them to do to best prepare themselves to work in the area that you're working in as a student and on this project, as well as what you plan to do in the future?
Well, coming through, perhaps like as a teenager, get involved in school. I know that the Urban Health Program has organizations that we as students go into the schools and create, health clubs that you can become a part of and learn about what opportunities are available for careers in this field. As you move in through college, for example, again, sort of reaching out to either your academic advisor or participating in other minority organizations that, have a health focus and sort of getting together with people that are alike, right? Finding a mentor, someone that looks like you, that has gone through the process as well, and really, asking for advice, as you come more towards the graduate college. Again, I will speak to our minority organization. We have within the School of Public Health, the Minority Students for the Advancement of Public Health, which, focuses on, sort of embracing our students of color and providing a community for them as they go through graduate school. And just know that there are other people out there like you that are always available to support you. So seek out support, with other people, other students that look like you within the community.
Yeah, it's just been wonderful having you here today. You are one of our top student leaders, so it's always enjoyable to talk to you. How does this project complement your overall career goals in the future? And also, what aspect of this project in particular you find to be most beneficial?
Well, again, to me, this project represents sort of, this is to me spoken public health, right? It's really going into the hospital and speaking to a patient and providing information and allowing them to giving them a service that they need, right? This is for the uninsured and the underinsured, right? So it really is, again, just an opportunity to apply what you learn in the classroom. So to me, being able to go beyond sort of designing a research project and collecting data and analyzing that data, really living this process of creating, of being part of the creative process, really, of the project and participating in conjunction with the American Cancer Society and seeing how they have partnered with the University of Illinois at Chicago with our program and how, this is really community coming together to sort of help and protect and advocate for one another. It has been powerful, and it is my hope that when I graduate, that I am able to find other collaborations like this and that I continue to be part of the creative process for other organizations like this to come together and really smooth out all of the kinks that exist and, sort of bridge the gaps that exist that really hinder the ability for our people to find the services that they need.
It does indeed take a village to educate as
does.
well as to maintain health in our community. So I'm so glad when you describe so articulately the partnership that we have with the American Cancer Society, University of Illinois, and Stroger Hospital, together with the community elements.
Right.
All of the major stakeholders are available and represented in this project. That is extremely exciting. Do you think hopefully this is something that could be transferable to other communities? I know I wanted to ask that question earlier, but from your perspective, is this something you think could actually be duplicated elsewhere?
Yeah. Well, what we are doing is precisely that. We are, this is a pilot project, and what we're trying to do is sort of get the kinks out so that we can eventually roll this project to many other communities. And I hope that if I am allowed, that I can see this through, and it is my hope to see this definitely expand through many other, communities and health organizations.
Well, it looks like time is running out for us. I'd like to thank you, Kathy, for being with us today. You are doing some very important work, and I want to thank also Ms. Adrian White from the American Cancer Society, who had joined us earlier. I understand there's a caller. Is there? Oh, there's no more time for a caller. So I would like to again thank you. In the event that you want some additional information about this, feel free to contact the Urban Health Program at area code 312-996-7727. Again, the Urban Health Program number is area code 312-996-7727. You can also reach us online. Again, thank you for joining us for another edition of the UIC Urban Health Hotline.